of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. The land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and Anishinaabe to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and the Mississauga of the Credit First Nation. And today, the city of Hamilton is home to many Indigenous peoples from across Turtle Island, North America, and we recognize that we must do more to learn about the rich history of this land so that we can better understand our roles as residents, neighbors, partners, caretakers, and members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. As well, a reminder that all electronic devices are to be switched to a non-audible function, and members are reminded of the 5-minute time limit. Madam Clerk, are there any changes to the agenda?
Hi, Mr. Mayor. We have no changes for today.
Thank you. I will now ask for any declarations of interest, and if there are none, I will ask for a recess for 15 minutes. I don't see any declarations of interest. Council, none at all. Thank you. Motion to approve the agenda as amended, moved by Powers, seconded by Councillor Pearson. All in favor? I see hands, 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 and more hands. That was all hands on deck. Yeah, you needed to put up a formal vote, right?
I didn't get into e-scribe in time, Mr. Mayor. So
okay, all right. So let's take this as a manual vote for those that weren't able to do that either, including myself. So can we take that as a manual vote for approval of the agenda?
Yes, Mr. Mayor, we'll take that as carried.
Thank you. And then secondly, a recess for 15 minutes from now. So coming back here at 10 to 2. Moved by Farr, seconded by Councillor Pearson. Again, a show of hands on that motion. Councillor Clark, thank you. Okay. All that were present voted in favor of recess.
Yes, we'll take that as carried, Mr. Mayor.
Thank you. Council meeting. Madam Clerk, are you live at this point?
Yes, Mr. Mayor, we are live.
Perfect, thank you. Next order of business for me is to turn the chair. We did declarations of conflict, did we not, Madam Chair? Madam Clerk?
Yes,
I
Mr.
believe
Mayor.
we did. Yeah. So we're at motions. Let me just turn the chair over to Councillor Farr for the moment, and I have a motion to put forward. And I'll need a seconder for that, but I'll read you the motion. Yeah. Sorry? We're all good? Thank you. Whereas the province of Ontario, this is repealing of the city's physical distancing bylaw and face covering bylaw, whereas the province of Ontario entered the roadmap exit step on March the 1st, 2022, whereas the Ministry of Health announced their plan for living with and managing COVID-19 on March the 9th, 2022, which outlined the province's plan to safely and cautiously reopen the province and gradually lift all public health measures by April the 27th, 2022. Whereas the cases of COVID-19 are relatively low and vaccination rates are high and increasing in Hamilton, and whereas Council deems it necessary to repeal the city's physical distancing bylaw and to rely on the province's regulations or guidance, read the same, and whereas Council deems it necessary to repeal the city's face covering bylaw and rely on the provincial regulations or guidance, read the same. I think I read that twice. I mean, maybe it's two different things, but in any event, therefore be it resolved that the bylaw to repeal bylaw 2155 as amended, a bylaw to require wearing of face coverings within enclosed public spaces and to amend City of Hamilton bylaw 17225, being a bylaw to establish a system of administrative penalties, bylaw 20164, a bylaw to promote and regulate physical distancing in the City of Hamilton, and to amend bylaw 17225, being a bylaw to establish a system of administrative penalties, and bylaw 20202, a bylaw to amend bylaw number 20155, a bylaw to require the wearing of face coverings within closed public spaces in their entirety be passed, and that the bylaw to amend the bylaw number 17225 as amended, being a bylaw to establish a system of administrative penalties as follows as passed. Item I, deleting the following table in its entirety. Table 22, bylaw number 20164, to promote and regulate physical distancing. And item 2, deleting the following table in its entirety. Table 25, bylaw number 20155, to face coverings bylaw. I'll need a seconder for that motion, and I would like to speak to it, Councillor Farr.
I think Councillor Ferguson raised his hand as a second, and Councillor Powers will follow you. Feel free to speak to your motion now.
Thank you. Much appreciated. And, this comes with, certainly from me, and I think from others, a great deal of consternation and difficulty. I would say it would have been my hope and wish that the province of Ontario would have delayed their announcement on opening, after the March break. But since they did not, it makes it very, very complicated, if not completely untenable, for the city of Hamilton to continue to enforce something that the province of Ontario has already said they don't want to continue to follow through on. It makes it very difficult for establishments and businesses in our community that, I think we're going to put them in conflict. People are going to be at their doors if we were to have if we were to continue on with the bylaw. That folks would be, giving everybody out there that's running a business or an operation, including the city of Hamilton, particularly hard time, if not an impossible time, to try and explain the differences between the two, and why we're holding it and they're not, and whether or not it's sustainable for us to continue to hold on to this bylaw given the provincial direction. So, in my view, to avoid all of that conflict, I think it's imperative for us to mirror what's happening in the provinces. Much as I would have preferred otherwise, I do concern myself, as I mentioned, in public health, with the less than 60% booster uptake. That continues to be a major concern and something that people need to turned their mind to not only consider vaccination and immunization as first and second doses, but more as Dr. Elizabeth indicated, critically important that they get the booster shot to be immunized from significant harm and hospitalization. That's where we're at, and only 60% of the population has taken it up. That's an outlying major concern, and you add all of that together. I would say I reluctantly bring this forward because I would have preferred otherwise, but I don't want to put all of our businesses, all of our public staff in an untenable situation where they're arguing, because they have a masking bylaw that's still in place when in fact the province of Ontario says it's no longer required. That's completely untenable, unsustainable over the short term, and would reflect on what the doctor said, which is highly recommend people continue to mask in indoor spaces. Highly recommend that people get their booster shot. I would say it's from my perspective, it ought to be mandatory. People need to get their booster shot. It's important. It's critical. It's part of keeping people healthy. It's part of the responsibility of being a community member, that you do your part to get the vaccine and get the booster shot. And if a fourth one comes along, which is likely to happen, that they get that one too, as many in our long-term care and retirement homes have received already. And so I bring this forward. I think it's a necessary step at this juncture in our journey through this pandemic. We're not through this pandemic by any stretch. You and I and everyone else wish we were, but the reality is we're not. And to completely throw caution to the wind sounds to me like the timing of that is a little bit off. I think this significant encouragement and requirement for people to continue to mask, I think, is important, and continue to look at the booster is continuing important. So I'll bring this forward. I have a seconder for that. Again, I would say I have reluctance. I have anxiety around this. I worry about the impacts of this in our broader community, but I don't see a way around what the province has already kind of let out of the barn in terms of policy. And so I'll leave it in your hands to determine whether or not you want to follow through. But if we fail to follow through, there is going to be lots of conflict in our community as a result of us sticking with a masking bylaw and a distancing bylaw that the province hasn't upheld and has to this date not continued to follow through on. So I'll leave that in your capable hands. Councillor Farr, thank you for taking the chair. I will take the chair back, and I will go to Councillor
Powers.
Thank you. Councillor Powers.
Thank you, Mr. Mayor. I will support this motion. In reviewing this motion and the approach we're taking, sometimes it's hard to balance how you would deal with this personally, vis-a-vis how it would affect the community that we live in. Probably myself, I'll probably continue to err on the side of caution and wear a mask until I'm as comfortable as I can possible in this whole thing. This bylaw here, the revoking of the repealing of the bylaw to be in conformity with what the province is proposing, is perhaps the best approach to do, because already I think all of us have had inquiries. I know I certainly have had them as a ward councillor on, how do you deal with this? How do you deal with that? And the whole deal. And when you're dealing with multiple jurisdictions in tossing something out, what is the gospel that you live by? So this gives some element to clarity. That's on the condition that clarity is provided. We can pass this bylaw and you read the bylaw itself and it's pretty confusing until we drill down into clearly black and white that not only individuals but the affected businesses will understand. So that's the segue into my first question is, if indeed this is passed by council today and the bylaw is enacted, is there a communications piece that will be made available to the residents and the businesses in the city of Hamilton almost immediately? That's my first question, please.
Thank you. Just on my part, I'll let the city manager answer, but we do have a media advisory scheduled for 3:00, where for all media, where we're going to announce whatever decision is made today, and then city manager, you can indicate other measures that you're going to use to inform the broader community.
Okay, thank you, Mr. Mayor.
Thank you for the question. Through you, Mr. Mayor. I see Matthew Grant's turned on his camera, and so I will let him speak to the details.
Thank you, Jeanette. And through the chair to members of council, we have a number of actions that we are planning on taking should council decide to vote in favor of rescinding the bylaws. There is a media briefing later today, which that'll be front and center. We're going to issue a news release. Social media will also have materials and information available at our different counters around town where members of the public might come. That's what we're planning for immediately today, and then ongoing education as necessary.
So supplemental to that, will there be a blast on the city's website that we can refer people to very quickly in order to see in black and white what our messaging is on this?
Thank you. Matthew?
Through the chair to the councillor, yes. So we will have information on our website, which includes a news release as well as text that'll be on the webpage, which people can send a link to any individuals that will explain, what we're doing and why we're doing it.
Okay. Thank you very much. Mr. Mayor, I have a second question, if you permit it.
Mm-hmm. Yep.
This one is business related. I've had some telephone calls today from the food retailers, and the question relates to specifically the people that work in their stores and service customers, whether they're cashiers or people behind the food counters or those preparing the foods. If this bylaw is enacted, will they still be required to use masks? Or will discretion be given for them to remove them?
Thank you. Who wants to tackle that answer? Monica?
I'm happy to. Monica Cirillo,
Okay.
Director of Licensing and Bylaw Services. Through you, Mr. Mayor, to the councillor, the only requirements that would remain in place with regards to masking would be under the ROA if this bylaw is repealed. And masking is required then until the end of April for certain areas. And that's only public transportation, long-term care, retirement homes and other congregate settings, shelters, and jails. So to answer your specific question, for restaurants or for employees there, masking would not be required.
Thank you. Thank you very much. My last comment is I believe in a lot of cases, unless bylaws are definitive, is they just should become minimum standards on human behavior and how we support our fellow individuals. And I think we're there. Let's make sure that it doesn't come back to bite us. Thank you, Mr. Mayor.
Okay, thank you. Councillor Pearson.
Thank you, Mr. Mayor. I do have a couple of questions, and I segue on to Councillor Powers and Monica, if you just clarify. So I have what you listed, that they will require to wear masks, continue to wear. When you say congregate settings, and I'm being asked, is this churches, banquet halls? Could you please clarify?
Thank
Yeah,
you. Monica?
Through the chair, no, congregate settings would be more living establishments. So other healthcare congregate settings, retirement homes. Unfortunately, I don't have the regulation right in front of me, but no, it would not speak to churches or places of worship. Masking would no longer be required there.
Thank you, and I wanted that clarification. And if I could, Mr. Mayor, through you, if Matthew Grant is still there or Jeanette Smith, I just want to tag on to whatever is publicized today. There's the media notices that go out, not only blast today, but even in the paper, that we also include the importance of getting a booster, the importance of continuing to wash hands, the importance of still, doing your best to protect yourself, because you are protecting people around you as well. So that will
through the chair to the councillor, Councillor Pearson, I can confirm that ongoing information and health and safety information will be going out. Specific to a booster campaign, my team is actually finishing off a campaign that will speak to the importance of getting a booster shot, as well as other elements that public health and medical officer of health finds important in terms of public safety. Our commitment to the community is to continue giving them the information they need to stay safe, and that includes booster doses and others.
Thank you for that, and I apologize. One real quick last. Sorry, Jeanette, did you have?
Yeah, if you wouldn't mind, Councillor, if I could add a couple comments through the mayor. If you're hearing confusion or questions in the community, because often you do, as the one you just mentioned, Councillor Pearson, please forward that to Matthew, and we can make sure our communication campaign continues to evolve based on the feedback. I think also we could, as we do our social media, provide members of council with the, the social media pieces you can use in all your communication channels as well.
Excellent. Thank you for that.
Yep.
And real quick, Mr. Mayor, last one, I apologize, I didn't ask Monica earlier. Monica, how are we going to deal with the situation with the schools that are continuing to require masking by the students? Will that be a self-policing at the schools?
Thank you. Monica?
Through the chair to answer the question, the bylaw itself never regulated schools. So I may defer to legal to see what that legal authority is over the school board, but our bylaw officers would be playing no role in that.
Is there someone from legal in attendance?
I think, just to be clear, I think we see the school board the same way as we see any other business or organization out there. They're making an individual choice to mask or not mask, as we may do as a city corporate entity. And the bylaw wouldn't have much to do with that. But I'll leave it to legal.
Thank you.
Good afternoon, Leanne Fioravanti from Legal Services, and I agree with what the mayor just said. They are a private entity. Our bylaw never covered them to begin with, and on a go-forward basis, we wouldn't have any jurisdiction enforcing their rules internally. Thanks.
Thank you. I just wanted for the public record and clear Isabel out there. So, Mr. Mayor, I will definitely be supporting this. It's been a challenging time. I will continue to wear a mask to protect myself, and that's now every citizen has that right to or not to. So I believe it's in order to eliminate confusion and allow our communities to start getting back to a new normal. I believe this is a step in the right direction, but just always with the caution that be careful, because we may be in another day, hopefully not, but maybe, where we have to take steps again. Thank you, sir.
Thank you. Councillor Jackson.
Thanks, Mr. Mayor. And right off the bat, I will be supporting your motion to rescind the masking and safe distancing City of Hamilton bylaws. I want to salute the 88% in our community that did the right thing and are double vaccinated. I'll say again, as I've repeatedly said, my family entirely, my staff, myself, we also have the third booster. I am concerned, as I asked at Board of Health a couple of hours ago, about the stubborn low number on the booster front of only 57% of our community that decide to get the booster. However, I think, Mr. Mayor, we've reached a point, and I know in talking to literally hundreds of my constituents over the last several months before Christmas and since, and when I've been meeting most of them still outdoors, but I have sensed that the majority of my constituents have reached a point where, as Dr. Richardson said, as Dr. Kieran Moore said, we're going to have to learn to hopefully live and manage this COVID. We've learned over humanity's time of how to learn to live with and manage the common cold. We've learned over humanity's time how to learn and live and manage the common flu. Emergency wards have often been absolutely flooded during the peak of flu season and cold season, and yet some way, somehow, we have been able to forge ahead and not be constantly in a state of either fear, lockdowns, economic downturns, whatever the case might be, and isolationism, Mr. Mayor, and causing fractionalism even within neighbors, families, friends. So, Mr. Mayor, I think this is, and especially once the province did announce back in late February about the March 1st, proof of vaccination would be rescinded. Today, their own policy and legislation is saying that the mandatory masking is being rescinded. And in another month's time, if everything holds well, as I believe we all, fingers, legs crossed, are hoping things hold well, and there's no increase in hospitalization and or in a dramatic rise and increase of COVID or Omicron cases, within a month's time, even the last bit of regulations and restrictions, even for areas of congregate setting, long-term care homes, et cetera, I believe by the end of April, that's the plan by the province, will be rescinded as well. Mr. Mayor, piggybacking on your point, when I heard Dr. Moore make his recommendations, I immediately thought of if we maintained our City of Hamilton bylaws on masking and safe distancing, I could just picture a hypothetical scenario at a supermarket where shoppers were going in, many of them now unmasked because of, as of today, the province has said it's no longer required. But if hypothetically, and the majority of my colleagues today will carry the day at this special meeting, if it's still to keep the City of Hamilton's masking and safe distancing bylaws, I could just picture one complaint from a shopper coming to that supermarket and our bylaw officer standing outside that supermarket, beginning to hand out tickets of $250 and $500, and people then arguing with our bylaw officers saying, well, hold it. The province of Ontario has rescinded the mask mandatory legislation. Oh, no, but hold it. Sorry, ma'am. Sorry, sir. City of Hamilton has continued on. It would just be an awful conundrum in terms of, again, causing even greater stress and pressures and pitting one against another. So, Mr. Mayor, are we, to conclude, are we perfectly where we should be? No. 2 years has been absolutely emotionally, mentally exhausting. But salute the 88% that got double vaxxed, and to the overwhelming majority of all, save for the East Mountain constituents and residents that I have the honor of representing. They have done absolutely the right thing, washing hands, masking, safe distancing wherever I've gone these last 2 years. I salute them. They've done the right thing. But I believe we've reached the point to, quote, learn to live and somehow manage where we are with COVID. I'll support your motion, Mr. Mayor. Thank you.
Thank you for those comments. Councillor Wilson.
Thanks, Mr. Mayor. I certainly echo some of your comments. I feel the weight of this decision. And I think overwhelmingly this province, through its public health units, has been well served. There's been a lot of discipline displayed in not politicizing this pandemic and not seeking to undermine the legitimacy and perceived legitimacy of medical science advice that is being offered. And I think we've also seen examples of too many, maybe not too many, actually just a few, seeking to hijack tragedies in the pursuit of hate or non-inclusive means. So it is a very difficult decision, I find. But I have to go back to the very principle that was set out in a correspondence that we endorsed in our Board of Health meeting, and that is, as a Board of Health, that our commitment is to improving and addressing and identifying health inequities. And I acknowledge the province is putting us in a really untenable position here. That we should be changing restrictions when it is reasonable and safe for populations that are the most vulnerable, not for those that are the least. And I think what's served Ontario and Canada well is there's always been a balance between community and the individual. And for the longest time since this started 2 years ago, ours has been on community enterprise. The messaging around masks from the beginning was, my mask protects you, and your mask protects me. And if you're not wearing a mask, then you're not protecting me. You're not protecting your most vulnerable neighbor. You're not protecting that essential worker who has no opportunity to work from home like we do right now. And when I'm considering this decision, I keep on asking myself, what directive does this, who is served by this? And who is harmed? And I would have thought there would be more provincial discussion around the infrastructure that necessitates, or at least acknowledges, the health inequities that exist. So the Ontario Science Table has told us that N95 masks, I think, provide an 83 to 85% protection. But we know that our most vulnerable residents do not have access to those, and they are more expensive. We know that our most vulnerable residents do not have access to sick pay. So when they're forced to isolate, their family and their neighborhood suffers. We know that those living in higher density residences, in terms of their air ventilations, is not adequate. There's no provincial programs, no provincial mandates, no articulation of guiding principles on that kind of infrastructure. That is what public health, that's equity in public health. And earlier I was referencing, and I said I would bring it forward, the Ontario Science Table, which, as you know, put out its last report on March 18th, I believe, and Dr. Peter Yoni, who is the head of that, spoke to it, has spoken to it publicly subsequently. And this is what gives me pause. The projections released from that science advisory table were very concerning to me. Moderate scenario is a 40% increase in contacts, and half of those contacts are going to be now maskless. It will project perhaps in 300 people in ICUs at the beginning of May. So that's more than double where public health measures if we retain them. Other things that give me pause in my responsibility to the residents of Hamilton is that we know that marginalized persons and persons of lower income are much more susceptible. And the science table showed that. If I could give you a second here, Mr. Mayor, I apologize. The rate of death per capita from the lowest income quintile is double that of the highest income quintile. In Hamilton, we have too many of our friends and neighbors living in code red conditions. You cannot at the same time call for provincial uniformity when previously you called for the recognition of regional differences. That's a significant regional difference that is specific to this city. Our lower income neighborhoods are more vulnerable. Our data showed that. Vaccine coverage with third doses has plateaued in all age groups and is lower in marginalized communities. That's particular to our community as well, Mr. Mayor. So what Dr. Junie was asking for was just a little bit more time. The data has, the numbers have plateaued. he's explained that he realizes that it's not sustainable for us to keep all of these measures intact. But he is expressing and has expressed his concern about why now? Why can't we wait and see what happens when we move past March 21st? And I think in that regard, I must express my opposition to your motion, but I do share your reservation about the situation and the untenable situation it puts us in as a council. But in closing, in speaking about local businesses, Matt, wearing a piece of cloth across your face is not the equivalent of a lockdown. Your business is not having to close.
Yeah. Go ahead.
Whoops. Councillor Johnson, you're not on mute.
Thanks.
Hopefully she'll figure that out. Go ahead, Councillor.
No, that's fine. Thank you. Your business is not having to close. Universal masking indoors is a really low barrier safety measure. It reduces the disparities that are facing this community in terms of risk. And it, more than that, it equalizes opportunities to socialize. It gives everyone an opportunity to take advantage of where we are right now, born out of hard work and respect for each other and that community enterprise. And for me, that is equally important. And in closing, I could just say, there is a report just issued out of the Lancet. I won't cite it in detail, but it does reference the significant cost savings and the cost effectiveness of these kind of precautions, specifically well-fitting, well-made masks. Billions of dollars are saved in economies and healthcare systems. So all of that said, Mr. Mayor, I'm afraid I cannot support the motion. I can support the motion to, in terms of physical distancing. I think we can be there now. We're there anyway. But on the masks, I cannot. Thank you.
Okay. Good comments. Thank you. Councillor Danko.
Thank you, Mr. Mayor. I was having a little technical challenges earlier, so my apologies if I might have missed some of the initial discussion. Just trying to recall and clarify the jurisdiction issues here between the province and municipalities. So my recollection of when this masking bylaws and physical distancing bylaws were put in place, municipalities, businesses, organizations were encouraged, as Councillor Wilson noted, to develop local standards, and the province refused to put in provincial-wide mandates despite our strong request that they do so. So now that we have these bylaws in place, the province has now put in provincial mandates and is repealing them. So I'm clear, and so the public's clear, we do have the jurisdictional authority to maintain these bylaws if we so choose as a municipal council.
Monica, you might be best to answer that. Legal is here as well. My answer would be yes. Monica?
Through the chair to the councillor, yes, the question or the answer is yes. Neither one of these bylaws are tied to the emergency itself. They were passed under the Municipal Act, so it's up to council to repeal them.
Thank you. And, you know, I will point out it'd be much easier to repeal these measures if the province would have taken the lead in the first place in putting them in place, because we would have never had these bylaws on the books if they would have taken that role right off the bat. This is a decision that not only affects the City Hamilton through municipal bylaw, but also businesses, organizations. So this is kind of tied together through our earlier discussion with public health, but is the specific public health recommendation that masking mandates, physical distancing mandates be lifted following the provincial recommendations?
Dr. Elizabeth still with us? Doctor?
am still with you,
There you
Mr.
go.
Mayor.
I'm so glad
Um,
you're here.
It is our recommendation that we move forward in this way. We do have to make this transition at some point in time. And as Councillor Wilson has outlined, the impacts will continue to be different across the different parts of our community for health equity reasons. But as we move forward to look at the numbers and where we are, the decreases that we've experienced, the residual rates that are here with this particular virus and this variant, I should say, of the virus, we are in a relatively stable place. As we have opened up, we've not seen increases. We have not seen the resurgence we initially predicted, though we will continue to monitor for that and may well see some swells as we go forward. But to take that step now and to align ourselves with the greater messaging and the greater situation that we're in, we think will be less confusing to people, and will allow us to make our messaging clear and consistent around the recommendations as we go forward and the guidance around continuing to use public health measures, to continue to do one's own risk assessment, continuing to promote and respect the choices that others are making, and to continue to look at how things might change and how we might need to adapt things as we go forward.
Councillor Danko.
Thank you. And a follow-up question on that. So as Councillor Wilson pointed out, the mask that I'm wearing doesn't protect me. My mask protects others from me transmitting anything to them. And that was always, in my understanding anyway, the reason for masking and the mandatory mask regulations was, my mask protects you, your mask protects me, as was stated. So currently, the public health recommendation from both the City Hamilton Public Health and the Provincial Public Health is that the official recommendation is to wear a mask in indoor settings. Possibly in any public setting, I'm not sure exactly, but if that whole notion of the mask is protecting others, not yourself, then why would we have a recommendation to maintain masking without having a mandate so that everybody is masked? They don't seem to make sense.
Through you, Mr. Mayor, I can appreciate why that's a challenge in terms of that. And I might turn to Michelle at some point, because she is one of our more technical gurus from a infection control perspective. But essentially, the different types of masks that are available do have differential impacts for oneself and for others. And so, the Councillor Wilson referred earlier to N95 masks, KN95 masks. Those do have additional benefits in both directions as they're used. Medical masks and cloth masks tend to be better at preventing one from spreading the virus to others. So that is another layer. They do offer some protection, but certainly not to the extent a KN95 does. So it is within that spirit of sort of these hierarchy of different things that we're asking people to do. I still put as the foundational one, stay home if you're sick. We have rules for people who are contacts of cases, as well as cases for how long they should stay home wearing a mask if they do go out. Once they're past a certain point, all of those sorts of things are trying to layer all those initiatives one upon the other. So it does still make sense to recommend that people utilize them and to do that risk assessment. But of course, the impacts are greater, the better the quality of the mask that one is wearing. And so that's where you also see like wearing 2 medical masks and those sorts of things. But that's sort of how they're designed to layer together. I don't know, Michelle, if you wanted to add anything.
Thanks, Dr. Richardson. No, I don't have a lot to add to that. With respect to masks, yes, that was our initial messaging, that it does protect others. Your mask protects me, my mask protects you. However, as Dr. Richardson stated, when you get into those better quality masks, if you will, be they surgical masks, N95, KN95, a very well-fitted surgical mask, certainly offers some protection to the user as well as to others. So I think it depends very much on the type of mask you're wearing. And so there is some protection for yourself as well as those around you.
Thank you.
Thank you. Final question, Mr. Mayor, is just on our municipal counterparts. I believe there were a number of municipalities that that had similar municipal masking and physical distancing bylaws. Do we have an idea? Are our municipal counterparts similarly repealing theirs? Have any maintained theirs? Do we have a sense of what's going on in other municipalities?
Yep.
Through you,
Doctor?
Mr. Mayor. Perhaps I'll begin. Monica, you can certainly follow on. My understanding from talking to my public health colleagues is that they are, all the ones that I'm aware of have been repealed or are being repealed. I'm not aware of any that are being maintained, but Monica will, of course, have her intelligence from her colleagues in municipal law enforcement as well.
Monica?
Through the chair, just to follow up on what Dr. Richardson said, yes, my counterparts are the same, echoing what Dr. Richardson had said. They've either been repealed or they were never reinstated in the first place when they originally expired in early 2021.
Thank you. Those are all the questions I had. But just to reiterate, you know, we would never be in this position today if the province would have stepped up into the leadership role way back at the beginning. Thank you.
Thank you. Councillor Knapp.
Thank you. Through you, Mayor. No further questions, just comments on the motion. Statements, actually. So when we began this journey as a city in putting these bylaws in place, we held paramount the need to protect each other as the guiding principle for these bylaws. We saw and acknowledged that wearing a mask is an act of care, of protection, and I would say an act of love for others around us. And at Board of Health this morning, we heard very clearly in the statistics and the data that we're currently seeing, it's characterized as a small increase, but nonetheless an increase in the number of cases that are being reported here in Hamilton. We also heard today at Board of Health that some will be at more risk than others. And those who face the highest risk here in Hamilton are seniors, people with disabilities, and Hamilton is home to the largest density of people living with disabilities in the entire province. That those who are immunocompromised or have other correlating health risks are also compromised and vulnerable. And that it remains true that in Hamilton, our experience is that those who live in lower income areas have the lowest vaccination rates. While we also acknowledge that vaccination and being triple vaxxed reinforces your protection and reinforces the protection of our community as we carry through this pandemic together. Asking those who are most vulnerable and face the highest risk to their health through infection by COVID, asking those folks now to, as a society, that they're on their own, that we are now going to lead with individual choice rather than the act of love of protecting each other and those who are most vulnerable among us, is not a direction any of us want to take. I truly believe that. And it is wholly unfortunate that the province has not demonstrated leadership and has left this to being locally based decisions. I got to say, I'm so thankful that we did make that decision back then in the pandemic. And it is under the principle of the Ontario Public Health Association standards that require health equity as being the foundational standard by which we carry out public health services, public health programs, and public health practices here locally, that I can't support repealing this right now. Not when so many folks and experts in the field have pointed to the value of waiting a little bit longer, especially after March break. So echoing the comments that have been made previous to myself, echoing also your comments earlier, Mr. Mayor, in terms of a difficult decision that Hamilton is being placed in and the conflict that we are facing locally versus provincially. But I simply can't support it because it will structurally reinforce health inequities in our city. And it will basically say to those who are most vulnerable among us that we are not prepared to protect them by encouraging this masking a little bit longer. Thank you.
Thank you. Councillor Ferguson.
Thank you, Mr. Mayor. And it's my only comment today, but I think since I seconded the motion pretty clearly, I support it. And an observation I've had during this whole COVID experience has been one where all levels of government, not just municipal, not just provincial, not just federal, all levels, when they try to take leadership on something, it just draws out a lot of criticism. And that's not to say that our decisions shouldn't be criticized. Yeah, a lot of them are. But this criticism has been very loud, very obnoxious, very aggressive, and sometimes threatening. I remember writing a column in Lancaster News encouraging our citizens to get vaccinated back. I think it was in late January. And I was checking out of a grocery store, stopped to get a piece of pizza and take it in the car with me as I was going to my next location. And some guy turned around who was in front of me and started screaming at me, shouting profanities and threats. And so I just said, this conversation's over. I'm not going to have this conversation with you doing this. And I felt so sorry for the poor checkout clerk. She didn't know what to do watching this unfold. So I don't know what it is. No matter what level government does something, it draws very aggressive opposition. The best example is the protests in Ottawa, where the federal government was criticized terribly for not taking action and clearing that place out. So they finally did. And they put in place the Emergency Measures Act. It went in place for 4 days. It cleared it out. And they got nothing but criticism for doing that. And we've experienced it also. And in this one, at least I have. I'm sure a lot of you are getting emails now saying, don't you dare get rid of those vaccines. And not quite as aggressive, but pretty strong. And I'm not sure what this means, how there's such strong rooted opposition to both sides on every issue that as you try to move forward. But as you said, Mr. Mayor, we can't be disconnected from the province on this one because it would just confuse the daylights out of the public, and that's been said enough, I think. Since the start of this thing, we've always tried to follow the science. As I watched the debate over the last few months, we always listened to what Dr. Richardson said, or in the United States, Dr. Fauci, and of course the provincial medical officer of health and the federal medical officer of health. And so I think the decisions coming out of council have been relatively consistent with what the scientists are telling us, because I'm sure not an expert in this. And so what these science tables and the medical officers help tell us, I just follow their lead on it to make sure we try to do the right thing. And I just got back from a 2-week vacation down in Arizona, and you wouldn't even know there's coronavirus going on there. It never is on the news. Nobody wears masks anywhere. In fact, I wish I took a picture of it. We walked by one retailer and he actually had a sign in the window, it's okay to wear a mask in here, in the store. And so there's such a diverse community, but it's time to move on with our lives. It's time to get back to some sense of normalcy. I know the kids need to see facial expressions at school of their teachers and their classmates, and they need to have their own. And, once this is over, they'd be able to do that. So once again, I've always supported the science of this thing, and I continue to do what the province has suggested we do because it just makes things more consistent. So as I said at the start, I'll be fully supporting it. Thank you.
Thank you. I think we're all familiar with damned if you do and damned if you don't. One way or another, it's going to extract criticism, but we make our best decision based on the best information we have available.
But it's been especially strong on the COVID issues.
Yeah, for sure. No question. Councillor Pauls.
Thank you, Mayor. I believe we're in a new position now. Just over 2 years ago, we didn't know what COVID was. I remember I was in Florida and I was told, get back home right now. The border's closing. It was so scary. We had no idea. This has been over 2 years. And I agree with Council Ferguson that, you know, we do one thing, we follow one sign, so we don't follow the other sign. Right now, we have followed the Ontario medical doctor for over 2 years. They have stated that COVID-19 continues to decline. Dr. Richardson said that. We also have stated that there's a high vaccination. We have with one vaccine 90%, 12 and over, and 88% with two vaccines. They also said that the hospitalization is in decline. So I will support this because we have followed the signs and it is coming from the Ontario medical doctor. And I agree, sometimes it is politicized. If it was another party, I don't know what people would say. I have no idea. But I do not want to see a city divisive. I don't want to see the province divisive. And I don't want to see a country divisive. I love our country too much. And if you were to ask me, what does my ward want? I don't know, because it's probably 50-50. I will offend somebody today. I will get an email saying, you don't know what you're talking about. Or I will get an email saying, thank you for voting this way. So I just want to say we should follow the province. I remember 2 years ago when it first started, and I think it was around April, May, that the province was saying we need to shut down hairstylists, we need to shut down everything. But some stores were open, like the big box. People were calling me saying, you can make a difference. Why should I be closed? You know what I would say? Blame it on the province. And now that the province is lifting mandate, which we have had for over 2 years, mandates are always there to be lifted. And we are shown, even Dr. Richardson said today, and I wrote it down, it's a guidance and it's a requirement. The requirement, it means it's a choice. You evaluate what you feel comfortable. If you have an underlying issue, you should wear a mask. You know your health, you know your body. So I think, and you assess your own health, wear a mask, we will applaud you. Don't wear a mask, fine. We need to be united as a city. We need to unite it as a province. And I will support the mayor's motion because we have followed it for the last 2 years. So I hope it passes. I hope we could realize the people have choices now after they evaluate this pandemic. It's been over 2 years. It's not like 2 years ago. We know what works. We know what doesn't work. So I hope it passes, and thank you for giving me the time.
Thank you. Councillor Clark?
Thank you, Mr. Mayor. So if I understand correctly, the provinces removed their mandate for masks. We had our bylaw in place first for masks and social distancing. We kind of led the way on it. By the province removing their mandate, it would leave the city of Hamilton in a position that we'd be enforcing a mask mandate on our residents, where if you were going into a provincial building, you wouldn't have to wear the mask. And I don't know how would we even lay charges against people for wearing a mask when the province said the mask mandate is over. And how we would defend that in a courtroom when the evidence is that the province removed that mask mandate. So it's kind of this catch-22. If you want to maintain the mask mandate because you feel that there's still risk out there, the challenge is the province removed theirs, so how are you going to enforce yours? And then the last thing I would want to mention is if we don't do this, we are really setting up the businesses to take an awful lot of abuse at the door. If we have a mask mandate and people are going into those businesses saying, wait a minute, the province said we don't have to wear a mask, and that poor mom and pop pizzeria, restaurant, whatever the case is, now has to deal with this disgruntled, angry resident. And Councillor Ferguson's bang on. The abuse, the language, the anger that I have received on the phone over these mask mandates and vaccine mandates, people are just ripping a strip out of each other, and we got to let this has got to stop. So let's follow what the province is doing, remove the mask mandate. If people are still encouraged to wear masks because they're immunocompromised, like I am, I go into the doctor's office, I wear a mask because I don't know what else is in that office. So I'm just being cautious for myself. I usually wear 2 masks. I don't see any other way around this. I think the mayor's motion is absolutely correct. I do not see any other way around this. If we try to keep our mandate in place, the legal conundrum we're going to create is huge. The anger from residents is going to be huge. The anger from businesses, which have already been abused throughout this entire process, is going to be huge. I don't want to be going to those places and say, well, we were still a little bit nervous, so we thought we'd give it another 4 weeks. It's not going to work. How are our municipal law enforcement officers going to deal with this when they're going out there to enforce a mask mandate, and yet the province has rescinded theirs? So it's while it may be a ticklish position to be in, I see no other way for us to move forward except to make sure that our mask mandate is congruent with what the province is doing as they're moving forward. And then we continue to monitor the situation. It may change. If it changes and the science comes in and tells us that we have to do something different, then we can do something different at that particular point in time. But right now, I think the motion that is written before us is what needs to be done. And I thank you, sir, for offering it.
Thank you. Good comments. Thank you. Councillor Marula.
Thank you, Mr. Mayor. Just quickly, I want to thank Dr. Richardson, because I'm sure her and her associates have been through a lot over the last couple of years. Having said that, from day one, and I believe I moved the motion either for the, excuse me, the distancing or the masking, or both for that matter. And I did so confidently because Dr. Richardson told me it was a good thing, because I believe in experts. I don't believe in experts only when it suits my political partisanship. I believe in the experts and the science all the time. And right now, that same expert is giving us a recommendation. So it really does beg the question. If you're going through a 2-year pandemic and you hear people continually saying, listen to the science and respect our medical officers' health, to only be subjected to now because of, for whatever political reasons, suddenly that expert is no longer respected. I'm beside myself, to be quite frank, and I'm saddened by it, but I'm not surprised. So, if we can just move forward and be consistent and predictable, we wouldn't continually look so dysfunctional publicly. I understand it's an election. Get over it. Because it's going to happen regardless. But at least be consistent and don't embarrass yourselves. Thanks very much. Thank you.
Okay, I'm going to take that opportunity to follow through on what was requested earlier, which was to split this between masking and physical distancing, is what I recall. So, Madam Clerk, have you found a way of separating all the bylaws out to make that happen? And then we'll get to the vote. And I think most everybody knows where they're going to land on this issue. So we can debate forever, but there's a time to make wine, and there's a time to drink it.
Yes, Mr.
Madam
Mayor.
Clerk.
So I would recommend you split A of the motion into 1 and 2. 1 being
Right.
a bylaw to promote and regulate physical distancing, and 2
Right.
would be a bylaw to require the wearing of face coverings.
Okay, that covers it, I think. Does that satisfy? So let's go to.
Mr. Mayor, could I, just for point of reference, could I have the recorded votes of the original motions I brought forward regarding masking and regarding the distancing? Just for a point of clarity.
Probably not right now.
But if we could have that email to everyone, it'd be greatly appreciated and made public. I think it's an important indication of the quality of decision making. Appreciate it. Thank you.
So I would suggest that you can ask for that information, and you're free to share that with all members of council. So we got 2 items. Thank you. 2 items.
Mr. Mayor, please, point of order, Mr. Mayor. Would you or the clerk please read each one, and are we moving to rescind or approve? I don't want any confusion on this very important decision today, please. Thank you.
Just in a nutshell, we are rescinding the masking bylaw, and we're rescinding the physical distancing bylaw. Clerks are going to make sure that all the appropriate words are and all the appropriate bylaws are attached to each of those recommendations, but that's essentially what we're voting on.
So if I support both, I am supporting to rescind both, correct?
Correct.
Thank you. Thank you, Mr. Mayor.
So
Mr. Mayor, for clarity, sorry. For clarity, A1 will be a bylaw to promote and regulate physical distancing.
Or rescinding.
Rescinding.
Repealing, yeah, we're repealing that
Rescinding
one.
the bylaw to promote physical distancing. And
Yes.
A2 will be rescinding the bylaw for masking.
Correct.
Okay. So on item 1, which is the bylaw to rescind physical distancing, all in favor?
Mr. Mayor, I don't have the vote
seconder,
before me.
please, Mr. Mayor. I know, sorry, is
It's
Councillor
myself.
Ferguson doing both?
Myself and Councillor Ferguson doing both, correct?
Thank you.
Mr. Mayor, sorry to interrupt. I don't have the vote before me, but I support Dr. Richardson's recommendations on all fronts. Thank you very much. I appreciate your time.
That's a thumbs up on both. Appreciate it. And when it comes up, Councillor Powers is thumbs up. This is on physical distancing now. I don't see a vote, so we'll give our clerk some time to get it up. Anybody else see a vote?
Lorraine's just going to split those for us. So the first one is physical distancing.
Right. I'm assuming I'm not missing anything, Madam Clerk. I'm not seeing a vote. As I think
Lorraine's
others
just
are.
setting it up. We'll let you know when it's ready to be displayed.
Okay.
Sorry, it'll just take a minute.
I can only fill so much time. Have you heard the one? No. Thank you for the great debate, by the way. These are not simple issues. And, you know, I know there's consternation all around, but it was respectfully debated, and I appreciate that. Vote is up. Councillor Powers had his thumb up earlier. Anyone else need to do a manual vote? You have to verbalize it now because I can't see you.
That carries 14-0.
Thank you. And the second item is on rescinding the masking bylaw in its simplest form. The vote is up. Please vote and submit. Councillor Powers, thumbs up. Councillor Marula had indicated his support for that. Did you vote or did you give us a manual?
Indeed. Thumbs up and strongly.
Thumbs up and double up on the thumbs up.
We're dismissing Councillor Vanderbeeks at this moment.
Okay.
And that carries 12-2.
Great, thank you. And thank you again for your respectful debate. The confirming bylaw, I'm going to turn to Councillor Farr just to confirm the bylaw 050051052. Councillor Farr, you have a motion to do just that.
I'm sorry, Mr. Mayor, we have to do B as well of your motion.
Oh, sorry. Oh, okay, sorry.
That's okay. And just to provide clarity as well, we can split 1 and 2 because 1 is related to physical distancing and 1 is related to face coverings.
Okay, so B1 and B2.
And Mr. Mayor, I
Yes.
probably should have the chair as these motions are being moved since they're by yourself. So
True.
yeah, no worries. I just thought of that myself. Madam Clerk, are we okay to just continue with the bylaw wording? Okay. And
So B1, just so we're everyone's clear, B1 is table 22. That is related to physical distancing, and that will change the APS bylaw.
okay, perfect. And I need a mover and a seconder. Okay, moved by Councillor
The mayor
Ferguson.
and for Councillor Ferguson for that.
Mayor Fred moves, Councillor Ferguson seconds. All in favor? I'll give you the chair back.
You got to do one more.
All right.
We need Councillor Nan's vote to come through. Oh, we have it. That carries 14-0. And item B2 is table 25, which was related to the face coverings.
Moved by Mayor Fred Eisenberger, seconded by Councillor Ferguson.
And that is open for voting.
Thank you. Councillor Farr, I'm going to ask you to finalize the meeting. I got to hop off to a media advisory starting right now. Thank you all.
And that carries 12-2.
All right, move to adjourn.
No, we have to do the bills, Councillor Farr.
Oh, the bills, of course, the bills. Thank you.
And I was just wanted to inquire if you wanted to split the vote on the bills as well. One is the bill being a bylaw to repeal bylaw promoting physical distancing, and the other bill is the bylaw to repeal the bylaw requiring wearing of face coverings.
Sure, if you'd like to guide me then through that, that's fine.
Okay, so Bill 50 is the bylaw to regulate physical distancing.
We'll look at that separately. Moved by Councillor Marula, seconded by Councillor Ferguson. All in favor?
And the vote is open. Councillor Powers is approve. Councillor Marula is approve. That carries 14-0. Bill 50 is a bylaw being to repeal bylaw 2155, a bylaw to require the wearing of face coverings.
51, you mean, or 50?
51. We just voted on 50.
You said 50. That's okay.
Sorry.
That's okay. I'm starting to follow along. I'm proud of myself that I caught that. That's moved by Councillor Ferguson, seconded by Councillor Powers. All in favor?
And that vote is open. Councillor Pauls, we're just waiting for your vote to come through.
And as we do that, Madam Clerk, the vote to confirm the proceedings would follow, and then we would adjourn, correct?
Correct.
All right.
And that is carried 10-2.
Thank you. And a motion to confirm the proceedings moved by Councillor Powers, seconded by Councillor Vanderbeek. All in favor? Or opposed?
Councillor Powers is approved.
Public Works Committee members, you need to log in as soon as possible. I think probably the chair might address a quick break, but let's go to that Public Works meeting right away and figure that out. A lot of people are ready to get started, I believe, and now I see
And that carried 12-0. Now motion to adjourn.
a mover to adjourn by Councillor Pearson, seconded by Clark. All in favor?
Councillor Powers is approved.
I approve as well.
Thank you, Councillor Bowles.
Thank you.
Good job, Chair
Councillor
Farr.
Danko,
You did a great job.
Yeah.
absent. And that carries 12-0. Thank you.